hands down the most effective, sustainable strategy, lifestyle-wise, that I coach patients in every single day is none other than fasting. But it's not just intermittent fasting, which is very good start. We've got to get into prolonged fasting. That's what I've developed, the FLOA protocol. In this video, we're going to discuss the approach towards prolonged fasting, the FLOA protocol, how we implement it for sustainable optimization of insulin resistance and lasting weight loss. But then we're going to also get into all the things that go around the fasting to give us a solution for insulin resistance so that we can start our GLP-1 medications, but eventually achieve lasting weight loss with complete independence or microdosing. Enjoy, guys.
What would be your guess as to how many calories you think you're eating per day, or have you never counted so you have no clue?
I have counted, I've tracked in the past, and I have a feeling I'm not eating enough because when I do track, it's usually less than 1,000.
Wow. Okay. So having counted, that's low, but that's why we do this. So having counted in the past, you think the last week or two has still been that low?
I've been trying to eat more whole foods,
Okay.
vegetables.
Gotcha. But you're still thinking it's probably pretty low.
Yes.
Okay.
Because now with the intermittent fasting, I'm only eating one meal and then a snack.
Yeah, so it's low. So let's do this. We're going to definitely do a reset for you. We're going to start you at 1,200 calories. So if we're establishing whether or not a reset, so Barbara is definitely doing a reset. So anybody who we decide we're going to do a reset, and make sure you rewatch that video, and just so you're up to speed, there are very specific instructions that you don't have to worry about writing down now. Essentially, if you're doing a reset, it's like a mini program in my program. Did you hit the calorie goal and changes in your symptoms? That way we can respond, great, let's increase the calorie. Because remember, the goal of the reset is to speed your metabolism up. It's to get your body out of that, you've probably heard me call it zombie mode, metabolic downregulation. It's the reason why you haven't been able to lose weight, Barbara, like hands down. So we gotta get you to realize, wow, I should be eating this much more, this much more. And so it takes time, both physiologically, body-wise, and mental-wise too, because
that's where I have an issue.
Yeah, no, and that's why it takes time for sure. But when you see this process firsthand and you realize, wow, I'm eating more, I'm not gaining weight, wow, I'm feeling better, because I tell you what symptoms to pay attention to, then it just reinforces it. You know what I mean?
Mm-hmm.
Perfect. We're going to talk about fasting in the rest of the program, but do you have any questions about your reset starting point, Barbara?
Not really.
Okay. Raise your hand if you think of something for sure.
Okay.
as the call goes on. Okay, Harrison. All right. So a couple of the same questions for you. Have you been on the GLP-1 medications before, or is this your first time with us?
First time. Yeah, first time.
And have you been trying to lose weight the last 2 months, or is this kind of like your starting point for everything?
I'm gonna say this is my starting point. So there have been some other factors that have played in that have kept me from losing weight. So we've gotten them all sorted out, and now I'm good to go. So yeah.
If you had to guess how many calories, and if you've never counted, then you have no idea, that's an answer too. But what would be your guess to calories?
I usually keep it around 25 to 3,000 calories a day.
Okay.
Yeah.
And you're an active male, right? So you're probably burning a lot of calories for sure. And over the last 2 to 4 weeks, has your weight stayed the same? Have you been going up? Have you been going down, eating the 25 to 3,000?
I would say that I'm pretty stagnant.
Okay.
Not down. Yeah.
Okay. So let's keep your intake exactly where it's at, because your weight's neutral right now.
Mm-hmm.
And just as a side note, guys, I like to be very fluid with this and just pick up parts where they're relative. So for Harrison and for all of you guys, when you're through the reset, Harrison's not going to do a reset. Instead of thinking standard weight loss, calorie deficit every day, right? That's standard weight loss programs. This is totally different with FLOA. We're not doing calorie deficit every day. In fact, we don't want you to be in a calorie deficit unless you're fasting. Now, what does that mean? Intermittent fasting is not what we're talking about, because the goal of an intermittent fast is to take your daily eating and compress it into 8 hours. It does not mean eat less that day, Barbara. And it's okay. Like, we're all victim of this. When you intermittent fast, at least in FLOA protocol, you could eat less and fast. Obviously, a lot of people do that. The goal for this protocol is to still get you to eat that full day's worth of food, which is In your case, Barbara, probably 1,800. In Harrison's case, it's closer to 3,000, right? So the goal when you're intermittent fasting is still get your full day's worth of food. But once we get into flow fasting, that's different. Now we go a full 24-hour periods and we're not eating, right? And in the case of flow, we're trying to go 48, 2 whole days, right? So once you guys get to that point when you're fasting for 48, that's going to be your entire week's caloric deficit in 2 whole days. And the reason why I say it that way is to really reinforce that the other 5 days you should be eating a full 3,000 calories. In your case, Harrison, or 1,800, Barbara and Vicky, probably somewhere 17, 1,800. Why do we do it this way? Because we're tricking the body so that it doesn't plateau again, or for the first time, because that's what causes the body to think, oh, starvation mode is every single day, calorie deficit, day in and day out, under eating. And so the body reacts to that in a plateau. It downregulates the metabolism. So with flow, having done old school weight methods for so many years of just that method, eating less every day, burning more, and realizing that what I've seen is it just much less often and likelihood of you getting into a plateau. That's why we do it this way. Not to mention all the hormone improvements that you get from doing that long fast. So does that make sense how we kind of partition and approach our calories? Fantastic.
Yes.
Perfect. So Harrison, no reset for you. You get to roll right into the program.
Cool.
Fantastic. All right, Vicky, same
Yeah.
question. I like your hat, by the way.
Oh, thanks. I need a reset. I've been on Ozempic for 2 years.
Yeah.
And the last year I haven't lost any weight, and they just keep increasing the Ozempic, and it's not helping. I've been watching you on TikTok many times, and I've been looking at as much of your information as I can. So
Awesome.
I did start the intermittent fasting, and I did lose 3 pounds, but now that you're talking, I'm hearing that is water weight. So I would say I still need a reset. I did start, like I said, the intermittent fasting, and it did help a little bit, but I really think I need a reset. I did move myself down from 2. I was all the way up 2 on the Ozempic. I moved myself back to 1 because it doesn't make any difference for me as far as food noise or cravings or whatever. So I thought, why should I take all this medicine? It's not helping. So I went back to 1. I was afraid to go any lower.
No,
because
for
I
sure.
don't want to gain weight, but I've been able to maintain all this time. I lost 20 pounds the first 6 months, 8 months that I was on it. And then after that, they just kept increasing. And my endocrinologist is just not very knowledgeable about this. She said, let's just switch you to Mounjaro. And I just didn't feel, after listening to you so many times, that was the direction I should go.
You
So
guys, yeah, totally.
that's why I decided to join.
Fantastic. Thank you for sharing that. I was going to say, did you guys see that I haven't got to finish watching it. I only watched the first hour, but there was a Congress hearing, a roundtable today. A few health experts were presenting to a couple congressmen about the healthcare issues in this government.
I am so sorry to interrupt, but could you tell me more about, I literally work there. Could you tell me more about that hearing? I would be interested to get the notes of that.
Yeah, this is wild. Let me pull it up because I'm still watching it myself. Let's see. It is Senator Ron Johnson. Here, let me just share my screen because I think everybody should watch this.
Oh, was it the health committee hearing today?
Yep.
Okay,
You're
yeah.
right. Yeah. So I just brought it up because whether or not this,
I literally do this for a living, so it's funny that you brought it up.
Yeah, no, look, whether it amounts to anything or not, it's awesome this time around. At least it's moving in the right direction. I think the powers that be that are literally killing people for the sake of profit, if I just can be blunt, they can only do this for so long. And so anyways, I brought that up. I thought of that because you mentioned your doctor. It's not even that your doctor is unknowledgeable. They're guilty of a healthcare system that teaches them and forces them basically to just use medications.
I understand that. Yeah.
It's crazy. But anyways,
it's crazy.
Okay, so let me ask you, Vicky, how many calories do you think you're averaging per day if you had to?
I'm averaging around 1,000. I use the meal kit Home Chef. So you
Okay.
always have a protein and a vegetable. And then I do the same thing. I do a little bit different for lunch. I'll have either cottage cheese and pineapple or a sandwich, like tuna fish sandwich, something like that, a light lunch. And then that's my dinner, home chef.
Okay. So let's do a reset and let's start you off at 1,200 calories, like Barbara. You guys get to start
Okay.
together at the same intake,
Okay,
the
good.
same goal. So for you, Vicky, now here comes the question. Should you wean off entirely of the medication or not? I can't give you that medical advice, but if it were me, I totally would. Here's why.
Would
You
you?
know,
Okay.
yeah,
Because I
I
am
would.
diabetic. I am diabetic and it is keeping my A1C down really well.
So that's the only exception. That's the only exception. So if we're doing this for diabetes, then you have to get like your doctor to be on board with where
I
your
know,
blood
yeah.
sugar's at.
Yep.
That's interesting though. You dropped from 2 to 1 and you are diabetic. Do you know what that did to your blood sugars?
No, I didn't even check.
I would go check that. I would check that right
Okay.
away because that's a whole
Okay.
different beast if you're using it to make, because generally if you're using it to manage your blood sugar and you decrease the dose, your blood sugar rises. So I would
Okay.
start, get back to monitoring your blood sugar every day and please confirm that didn't cause your blood sugars to go higher. Because even though the thought process is spot on the short term, if your blood sugars are rising because of that, then you need to get back to the dose, just as much as I hate to say that.
Just as a little, the reason that I'm even diabetic at all is because I was having steroid injections in my back. So I had a spinal injury.
Yeah.
And they said that caused my A1C to go really high, 12, 13. And of course, my general practitioner freaked out and sent me directly to an endo doctor. And that's when I started all this medication because I said to her, I can't move my belly fat either. The belly fat just will not go, even though I swim almost daily. I do laps. And
Right.
and so that's when she said, oh, let's try Ozempic. So she put me on Ozempic almost immediately. So I could possibly be able to no longer be diabetic. You know what I'm saying?
That actually, 100%. It was more of a situational short-term diabetic reaction.
It was.
So confirm it by checking your blood sugars and make
Okay.
sure. But assuming that you could keep lowering your dose and your blood sugars aren't taking off high, then go for it. But
Okay.
if your blood sugars start rising, let us know as well as let your doctor know.
I will.
Okay, cool.
Okay, thank you. I didn't even think about that. Okay.
No,
yeah.
it's yeah, absolutely. Okay, guys. So
Yeah.
you're through the reset. Once you get through the reset, the only modification to this program is that you cannot do long fasting when you're in a reset. So Barb and Vicky, you're going to have to eat every single day, 7 days a week, because of the reason of the reset, right? We got to get your body to think it's no longer starving. Once you graduate through the reset, then you're going to be exactly where Harrison is at, which is starting the long fasting. The long fasting is where the program really starts. 24 hours is the first stage 2, but that's really where it starts. You get comfortable with doing 24-hour fasting. You can do it twice a week, Harrison. Once you're comfortable with, that's when you go for the big one, which is essentially combining them into one. You go from Tuesday night to Thursday morning. And the first time you do, that's always a big leap because it's like, whoa, I went all day. I go to bed on an empty stomach. That's a weird kind of feeling, trust me. But then it gets easier. And you do that once a week once you're in that stage. And all you're trying to do is increase that up to 48 hours. And then once you can hit 48 hours, you're just riding that and riding that. There's weekly, right? Just kind of part of your life, part of your schedule. And the rest of the week, the target is to eat that full day's worth of food. Well, you guys remember what a full day's worth of food is because you just finished the reset. So that kind of gives you, without having to count your calories forever after that, you have a frame of reference. You're like, oh, I remember what 1,800 calories looks like. Harrison,
Right.
you know what 2,800 looks like because you've been doing it for a while. So I don't need you to stress about counting after the reset's over, as long as you can estimate that you're near what that full day's worth of food looks like. We're going to talk about nutrition in a second, but any questions on progressing yourself through the stages of fasting?
When we start the reset for Barbara and I, do we do intermittent fasting at all?
Intermittent fasting is totally okay during the reset, but not at the cost of not being able to hit your calorie goal.
Okay.
So the calorie goal is actually much more important than the fast. Ideally, you can hit the calorie goal and start your fasting, but you see how the fasting can make it harder.
Yeah.
So you got to.
So we need to get our 1,200 calories within an 8-hour window.
if possible, or get it over a 10-hour window. You know what I mean? Like calories
Yeah.
first, then intermittent fasting second.
Okay.
Yeah. Okay. Thank you.
Okay, I
Perfect.
actually do have a question. I'm sorry.
Yeah. No, you're good.
We're doing the 48-hour fast while on GLP-1, correct? Okay. I can start the 48-hour fast as soon as I get on it, or I can do the 48-hour fast immediately.
Yeah, totally up to you. I always tell people, if you're feeling froggy, then leap. Because the worst thing that's going to happen is you try to do a 48 your first time and you won't be able to, right? But you're trying, right? And who knows whether you're going to hit it or not. Let us know. What happens when you go for the big one right out the gate is you either do or you don't. And if you don't, you just document how long you did and you keep trying to beat yourself. The more conservative approach is, let me try 24-hour first, get comfortable with that. Then 24 hours in a week, get comfortable with that. And then 34. And then this is really your journey. This is your decision to choose the rate at which you want to progress yourself. The only advice I would say is, because it's a personality thing. Some people want to move really fast and some people are like steady and slow.
That's where I'm at, basically, is I've done the fasting before, just trying to lose weight with different ways earlier, past years, whatever, blah, blah, blah. And I find it just easier to just jump right in and do.
Yeah.
do
If you
it.
could jump right in.
I do 24-hour fasts regularly already, just because of like work and so busy and stuff like that. So I just needed to know if that's
Yeah, no,
achievable.
totally. If you have like autoimmune diseases and you're super stressed in your life, okay, fine. Then maybe slow down with your progression. But if you don't, then yeah, you can roll right into a faster and you'll get the results faster. So the GLP-1 will help, the AOD will help. So cool. Okay. Food wise, when you're not fasting, as you guys saw, it's a very simple concept. We're just trying to replace processed food. We're replacing processed and ultra processed food with unprocessed food. Doesn't need to be hardcore, doesn't need to be 100%, but we do want to go as clean as we possibly can 90% of the time. And then 10% of the time, that's your junk food, that's your wiggle room, that's whatever it is that you need for sanity's sake. And also, I just don't like the concept of even if you are motivated to go 100% hardcore, which sometimes we are, that's not sustainable. And I find that the more hardcore we go, the greater the likelihood of a rebound or an all screw it kind of thing. And I don't want that to happen.
If you're watching these clips from my coaching calls and wishing you can be part of the team, I'll put a link in the description, but we have thousands of individuals who are kicking ass using microdose intermittent use protocols and implementing sustainable lifestyle strategies, guys. Click that link, fill out your information. Now, back to the show.
If we need to go super strict because your body's not responding, then we will do that when we come across that. But if you're losing weight, you're doing good, you're doing the fasting, we're going to talk about keto in a second, that you're doing your keto, we're doing really fine. So anti-processed food diet, paleo Mediterranean, those are two representations, my favorite kind of approaches. And then I do want you to go a keto version of that for the first couple months. Doesn't need to be hardcore crazy keto, but if you could do 50 grams or less of net carbs, that's going to help us really become insulin sensitive as fast as we possibly can. Protein intake, very simple formula, between 1 gram, so about 1 gram between your target body weight and your current body weight in grams of protein. So if you weigh 200, you should weigh 150, then at least 150 grams of protein per day. If you have no clue how much you're intaking, because I don't want you guys to count macros, it's a pain in the butt, but protein would be a macro to consider counting for a couple days or a couple weeks so that you feel comfortable. Okay, that's what 150 grams of protein looks like.
Yeah.
Yep. Go ahead.
Sorry. So you're saying it should be based on goal weight. My problem with that is I don't know how to eat 250 pounds or grams of protein a day. I could get it in. I know how to eat. I was a football player. It's not that big of a deal. But like casually eating 250 grams of protein is not something that everybody does. So
it's hard.
Recommendations would be appreciated.
Is that's your current weight or that's your target weight?
That's my target weight. So right now I'm about 345 and I've stayed at 345 for about a year. And that's how I know that it doesn't matter how much I eat. It's 345 no matter what.
How tall are you?
6'5".
6'5". Yeah, I think 250. Yeah, 250 would be your target of protein. You're going to have to rely on supplements, probably, for sure. Me too, man. I try not to, right? The goal is always to get as much of your protein from whole food sources as possible. But if you can't, I would much rather you consume protein supplement, protein powder, if you absolutely need to. If you don't have a dairy intolerance, whey protein is going to be your best. That's your most effective towards the muscle stimulation and protecting muscle mass. but you can also throw in some plant protein as well. And as you saw, I'm a big fan of collagen, more for the benefit of hair, skin, and nails. So I always do 1 scoop a day, 30 grams of collagen peptides. Really good, believe it or not, ladies, for skincare. Collagen peptides, really a lot of good data on that. But that'll complement your protein needs as well. So yeah, rely on powder if you need it.
Okay,
Is
and
that-
then I'm sorry. I just have one more question. 250 grams of protein is a lot of calories as well. Are you more worried about hitting the macros, or are you more worried about hitting the calories?
I'm more worried about hitting the calories without having to count them, just estimating.
Right.
Then the only macros I want you to have attention on is the carbs, keeping it as low as you can. Don't need to count, just go as low as you can. And then the protein, don't need to count, but being able to know I'm somewhere in the vicinity of 250.
Okay.
So the macros will take care of themselves, because that's basically that means you have to eat a lot of fat, right?
Yeah.
In your case, you'll have 250 times 4, right? So 1,000 calories from protein, very little from carbs, and so the rest is going to come from fat, right? And so when we talk about fat, guys, oh, go ahead, Barb, you had a question.
You had mentioned collagen peptides. I
Yes.
do take collagen peptides. I didn't even think about putting that into my calorie count. I mix it into my morning black coffee.
Nice.
So does that have protein in it?
It does. It's not a complete protein, but it absolutely does have protein. So 20 to 30 grams of collagen peptides, about 100 calories or so. So
Okay,
it's
I'll have to check.
yeah, it's most likely going to be about 100 calories, depending on how many grams is in it. And it's not a complete protein, but your body can take incomplete protein sources and end up getting the full spectrum and making it complete. So you can still build muscle mass off of collagen peptides, but it's not, you wouldn't try to bulk up and build muscle mass off of that. 1 scoop of collagen is all you need, but cool. And then fantastic. So the supplements, I know there's a lot. So I broke down the supplements into sections for you guys. So let me pull that open. So I broke it down into sections. Where are we at? Supplements. So you got your essentials, and then you have your non-essentials. Now, as far as low dose naltrexone, which is a medication, is anybody here dealing with an autoimmune disease or an inflammatory condition of any sort?
No.
Post-COVID, anything like that? Okay, then we can skip that. So your essential supplements, these are the core supplements that I think every human should be on. Your vitamin D, your fish oil, your I have a little extra magnesium because of the GLP-1 medication. And I do have 2 forms of magnesium that I think getting both would be great. The magnesium glycinate during the day, and then magnesium threonate prior to bed will actually really help for a lot of people improve sleep quality because it passes the blood-brain barrier. So this is magnesium for the brain, and this is magnesium for the body. And then this is the link right here. If you want to get my favorite brands, you could just purchase there. You don't have to go for me, totally up to you. We are launching our own supplement brand here, hopefully in the next 3 months. But either way, this is a trusted source. And then electrolytes are obviously vitally important because you are long fasting. Don't forget this one right here. They do not make electrolytes for the intention of eating nothing. They make them to complement sodium being assumably high when you eat. So when you're not eating, you take the electrolytes, but you also add a little extra salt too as well. You'll know really quickly. You'll get headaches, you'll get crampy, you'll get tired, and then all of a sudden you take some salt and electrolytes and you're like, whoa, I feel better within 30 minutes. It's pretty crazy. Anti-inflammation. Inflammation is the second biggest reason why people don't achieve lasting weight loss after insulin resistance. Even if you don't have an inflammatory condition or an autoimmunity per se, we all have some systemic inflammation. Most potent supplements are curcumin and resveratrol, so they're like semi-essential. The rest of it is here. Vicky and Barbara, make sure you get 1 bottle of this. It's called thyroid CMV. This is going to help your body with the reset. It's going to help your thyroid recover much faster. Just all you need is 1 bottle. So make sure you order that right away, and then just take it as prescribed. There are 2 pills a day, 1 in the morning, 1 in the afternoon. If you're not getting 20 to 30, which I even don't, 20 to 30 different fruits and vegetables per week. That's key. Some newer research on the gut where we understand that, yes, we always known fiber is important. Like we know that, but a broad spectrum of fiber is a newer understanding. We're looking into diversity now of the gut microbiome. The more different bugs you have, the better your health is. And so the way that you get different bugs is eat different sources of fiber. And that's why 20 to different fruits and vegetables is very vital. Really colorful too. So when you're at the grocery market, regular carrots, get the color ones, get the different colors. Even different colors of the same vegetable or fruit provide different polyphenols and different antioxidants, which will be beneficial for different gut bugs. But if you're like me, you're not getting, I try my best and I still don't get it. I take 2 scoops of this every day just to supplement my fiber needs. Totally up to you as an option. And the rest of this stuff, again, situational. If you have these issues, you can ask us at any time. And then down here is the extra appetite suppression. So the reason why I put this here is it's nice to be able to have something that you can take on the fly to give you some extra appetite suppression, especially during a long fast, because you can't just inject more tirzepatide or semaglutide. Any questions on the supplement side of things? Fantastic.
That one was called thyroid CMV.
Thyroid CNV.
Okay.
Yep.
Yep.
And then the fiber.
And then the fiber. Yeah. I like I said, it's difficult to get 20 to 30 different fruits. That's 3 a day of different colored fruits. But for some people it's easy. For some people it's hard. So you're gonna have to make that judgment call. But that's a good fiber supplement. And you can't really go wrong with adding it either way, even if you are getting a variety, because fiber is always good. Okay. So stress and sleep can be a roadblock if you have it. If you have stress in your life, or if you're not getting adequate sleep. Is anybody here feel like there's extra stress in your life above normal? Fantastic. What about sleep? 7 to 9 hours of quality sleep. Are you guys getting that or not getting that?
I'm not.
Ceci's not here, so let me just send that video to you. By the way, guys, outside of FLOA University for quick videos, the YouTube page, a lot of good videos there, but let me send you the one that I'm talking about right now. There it is, fix your sleep. All right, so make sure you guys watch this when you can with the sleep issues. In the meantime, I just put it in the chat. In the meantime, while you guys are waiting to the benefits of implementing these changes to your sleep routine, get the sleep supplements. They're going to really help improve the quality of sleep. I really need you to get ahead of this because fasting for longer periods might make sleep even more challenging. And so you want to get ahead of this now and start to work on improving your sleep quality. If you guys ever start getting worse sleep from the fasting, let us know. Because we cannot compromise good sleep, even for the benefit of fasting. It's important. Finally, last category is your exercise. Of course, cardiovascular is great. Not saying cardio is not good, but the hands down, the most important form. And we got to prioritize our time, right? Because we only have so much time. Resistance training is always the most important part. You need to lift what's called hypertrophy training or hypertrophy. This is literally the same way you would build if you were trying to actually build muscle mass and get bigger. But Dr. Jones, I'm not trying to get bigger. I know, I get it. But when you lift like you're trying to get bigger, but you follow this protocol, you're not getting enough calories per week to get bigger. So don't worry about it, all the fasting. But when you lift that way, it's the strongest stimulus to your body to protect the muscle mass that it has. And that's what matters most, is protecting the muscle mass that you have on your frame. You're going to burn enough calories from the fasting. So don't worry about, I have to get my cardio in. No, you're going to be fasting so much. But training like that is vitally important. Barbara, do you have a pretty solid weight training program or no, not really?
I do.
Fantastic.
I do. Two to 3 times a week with a trainer.
Good. Okay, so you got that covered. Fantastic. Let them know that you want to, just in case they're not doing this, but let them know hypertrophy training is what you want to focus on.
Yes.
A lot of the trainers like to do the more circuit style just because that's always been the traditionally thought of as the best for weight loss, but not for this protocol. You want just let them know hypertrophy.
Okay.
How about you, Harrison? You got your weight training down?
Yeah, I use a lot of the stuff I've learned over the course of playing football. And then of course I still talk to my coaches and stuff like that and get updated weight training and stuff like that. But it's all like what you said. I only know how to hypertrophy lift, really, because I'm trying to be the biggest and the strongest guy on the field. So I only know how to do that. So yeah. I can do that.
Yeah, with the sports training, you'll get a lot of power, which is good. And then the strength is good with the lower rep range, but just make that little shift, and instead of doing 5 to 6 reps, more of that like 8 to 12 reps. That's the only modification. Okay, cool. Vicky, how about you?
No, I've done 0. I swim at least 4 to 5 times a week, but I have never lifted weights. I don't even know how to begin to lift weights.
You answered my next question. So usually the roadblock is I don't even know what to do,
Right.
or I know what to do, but I'm being lazy. So
No, I have no idea.
so how do you feel about getting a trainer for 5 to 6 sessions just to teach you
Sure.
a program? Yeah.
Sure.
One of the best investments you can do, find a local gym near you and see which trainers they have. Let them know, that you want to learn how to do an hypertrophy style training, and they'll
Okay.
get you, they'll get you comfortable around the gym. If you want a starting point to make those sessions more productive, watch the video on Flow University. Once Ceci gets you access, there's a video there where I teach you the basics of just like the terminology. That way it'll be a
Okay.
more productive meeting with your trainer.
Okay, good. Okay, yep, I can do that. Yep.
Any other questions at all, guys, about anything?
Oh, yes, I do have a question. Since we are resetting, I have not started what was that medication that you sent? It starts with an A, I think. AOD. Yeah, I have not started that. When do we start that?
AOD can be taken during the reset. We usually sell you enough, depending on who you worked with, assuming not counting a reset. So it's very beneficial. It's technically more beneficial during the program, but it's still beneficial during the reset. So if you want to start getting the benefit of the AOD, you can start that right away. If you want to wait, that's an option too. Just that's more of a financial question, but AOD is awesome because it starts to rebuild the metabolism.
Okay, what is it exactly?
AOD is a fragment of the human growth hormone. So specifically, it's the fat loss portion of the growth hormone. So you're not getting the growth hormone, you're just getting the fat loss profile of what growth hormone does. And that's important because when you're insulin resistant, your body has a difficult time mobilizing its fat stores. So as you get into the caloric deficit, your body increases the stress load on your body because you're forcing it to mobilize fat, but it's not good at it. So this is artificial fat adaptation, if that makes sense.
Okay. Okay. I do have some friends that have a functional doctor that they got on hormones, but I don't know what kind of hormones, and they're losing weight also. But I don't know what kind they have. So
Gotcha. Hormone therapy is a whole nother beast. Very important, like testosterone, estrogen, progesterone, thyroid.
yes.
We do check your thyroid. So when you have your medical call, they will go over your labs with you. Absolutely recommend you get your thyroid managed if it's not already, if we let you know that you need it. So
Okay.
Yeah, I just had my call this morning.
did they say your thyroid labs were good?
She said they were okay.
Got
She
it.
said they were fine.
Not
Her
great,
concern
but-
was my estrogen and testosterone. Or estrogen is 0.
Yeah.
Testosterone was 47.
So testosterone is not horrible, but your estrogen is really low. Are you thinking about doing estrogen and progesterone therapy?
I've been thinking about it for a long time. I just don't know where to start.
We obviously can help you with that. We do that therapy. The thing about estrogen and progesterone, it's not a direct weight loss thing, but it's a quality of life thing.
Mm-hmm.
There's so many symptoms of not having adequate estrogen and progesterone. Obviously, menopausal symptoms is part of it, but also it puts your body into more of a balance and harmony when it has just a little bit of estrogen, a little bit of progesterone. You age more gracefully. Your femininity, if you will, also increases too as well. Function down south feels better. It's a lot. Mental improvement. It's a big shift and a lot of good things. And then since you're on it, they'll probably give you a little bit of testosterone too, which is always nice as well. If you are interested, just text the FLOA hotline and we can get you set up with. Will probably sign you up. Is that right?
I want to see John.
Yeah, actually, just text him directly if you're interested in hormone therapy. So.
If you guys enjoyed watching this video, then you guys are gonna wanna check this one out. I take a deep dive into fasting and overall lasting weight loss strategies utilizing these GLP-1 medications in the best format, microdosing, intermittent usage. Check that out, guys. We'll see you later.